Hey guys, and welcome to How to Gastro. So in today's video, we'll be exploring what is a blood reticulocyte count test. So let's get started. So before we get into the specifics of the blood reticulocyte count test, let's talk a little bit about what you can expect when your doctor orders this test for you. So a blood reticulocyte count test is done with the taking of a simple blood sample. So here, a needle is used to draw blood from a vein in your arm into an EDTA or purple top blood tube. The collected blood is then sent to a laboratory where it is analyzed and resulted. So what are the reticulocytes and what is a blood reticulocyte count test? So a blood reticulocyte count test measures the number of reticulocytes, which are the immature red blood cells in your blood. So reticulocytes are produced in the bone marrow and are released into the bloodstream where they mature into fully functional red blood cells or RBCs. So if we take a closer look at this little image down here at the bottom of our screen, we can see that in the bone marrow, we have a hematopoietic stem cell, which becomes a pro-erythroblast, which then becomes an erythroblast, and then from the bone marrow, we have the formation of the reticulocyte or the immature red blood cell. And then finally, in the blood, this reticulocyte will mature and become an erythrocyte, which is also known as a RBC or a red blood cell. So now that we know what the reticulocytes are, let's talk about why they are clinically important to us. So the reticulocyte count can help doctors assess, number one, the bone marrow function. So the reticulocyte count helps to determine if red blood cells are being created in the bone marrow at an appropriate rate, as the number of reticulocytes in the blood is a sign of how quickly they are being produced and released by the bone marrow. Number two, reticulocyte counts are also important in the diagnosis of anemias. So a reticulocyte count or a retix count can help distinguish between different types of anemia, such as whether anemia is due to decreased red blood cell production or increased red blood cell destruction. And number three, the reticulocyte count can also help in determining how well a patient is responding to treatment. So a blood reticulocyte count test can monitor how well a patient is responding to treatments for conditions like anemia or bone marrow disorders or post-chemotherapy. So we'll explore all of this in the further slides and it'll all make sense pretty soon. So let's keep going on. So now let's talk about the normal reticulocyte count. So in normal healthy adults, an absolute reticulocyte count is around 20,000 to 100,000 reticulocytes per microliter of blood. And as a reticulocyte percentage, this is 0.5% to 2.5% of the total red blood cells. In normal healthy children, the absolute reticulocyte count is 25,000 to 100,000 reticulocytes per microliter of blood. And the reticulocyte percentage is 1 to 4% of the total red blood cells. So this is what the normal reticulocyte counts or the normal reference ranges of retics in the blood actually is. So now let's talk a little bit about abnormal reticulocyte counts. So a high reticulocyte count is known as reticulocytosis and typically indicates that the body is producing an increased number of red blood cells. This can happen for several reasons. So let's explore these reasons a bit further. So what are the causes of abnormally high reticulocyte counts? So coming in at number one, we have hemolytic anemia. So this is a condition that involves the destruction of red blood cells at a rate faster than they can be produced. To compensate, the bone marrow will increase red blood cell production, leading to a higher reticulocyte count. So this can be seen in autoimmune diseases like lupus, rheumatoid arthritis, or ulcerative colitis, in the use of certain medications like cephalosporins, levodopa, levofloxacin, methyl-dopa, or the NSAIDs, or it can also be seen in inherited conditions like sickle cell anemia, thalassemia, and even some infections. So anything that causes a hemolytic anemia may contribute to an abnormally high retics count. Coming in at number 2, we have acute or chronic blood loss. So when a significant blood loss occurs, either from injury, surgery, or internal bleeding, such as from a gastrointestinal ulcer, the body responds by increasing red blood cell production, raising the reticulocyte count. So this can be seen in cases like trauma, surgery, GI bleeds, or heavy menstrual bleeding. So anything that causes an acute or chronic blood loss, the body will have to try and compensate for that blood loss by producing more blood cells. Coming in at number 3, we have recovery from anemia. So if anemia, such as an iron deficiency anemia, is being treated effectively, the reticulocyte count may rise as the bone marrow responds to therapy by producing more red blood cells. So this occurs in cases where patients are seen by their doctor and are started on anemia therapies, such as with iron supplements in cases of iron deficiency anemias, or vitamin B12, or folate supplements, or erythropoietin supplements. This will all also cause a high reticulocyte count as the body is trying to recover from that anemia and normalize its red blood cell levels. Coming in at number 4, we have the hemoglobinopathies. So genetic disorders that affect hemoglobin structure or function, like sickle cell disease or thalassemias, can cause increased red blood cell production as the body tries to maintain adequate oxygen levels. So high reticulocyte counts will also be seen in sickle cell disease and thalassemia. So moving on, we have number 5, which is high altitudes. So living at high altitudes means lower levels of oxygen, prompting the body to produce more red blood cells to improve oxygen delivery to tissues, which in turn increases the reticulocyte count. So another cause of high reticulocyte counts in the blood could be living or traveling to high altitudes. So coming in at number 6, we have response to treatment of bone marrow suppression. So if someone with bone marrow suppression or aplastic anemia begins to recover, their reticulocyte count may rise as the bone marrow starts producing more red blood cells. So this includes patients that have started treatment with medications that stimulate the bone marrow, such as Epogen, Procrit, and Promacta, or patients that are recovering after chemotherapy, or patients that have had a bone marrow transplant. So coming in at number 7, we have polycythemia. So this is a condition that is characterized by an increased number of red blood cells, which can lead to higher reticulocyte counts in the blood. So this includes diseases like Polycythemia Vera, a bone marrow disorder, or secondary polycythemia due to chronic hypoxia or tumors that produce erythropoietin. The 8th cause of abnormally high reticulocyte counts is post-splenectomy. So the spleen plays a vital role in filtering out old or damaged red blood cells. So after the spleen is removed by a process called splenectomy, more reticulocytes may circulate in the blood, leading to a higher reticulocyte count. So here the cause will be the surgical removal of the spleen or the splenectomy that causes the high reticulocyte count. Then coming in at number 9, we have certain medications. So some drugs, such as erythropoietin stimulating agents, used in treating anemia of chronic kidney disease, can boost red blood cell production and elevate the reticulocyte counts. So here the cause will be drug supplementation, such as in cases of erythropoietin supplementation or supplementation with anabolic steroids. So these are all the causes of abnormally high reticulocyte counts. So now let's explore the abnormally low reticulocyte counts. So a low reticulocyte count is known as reticulocytopenia and typically indicates that the bone marrow is producing fewer red blood cells than normal. This too can occur for several reasons. So let's explore these reasons a little further now. Coming in at number 1, we have bone marrow disorders. So conditions that directly affect the bone marrow's ability to produce red blood cells can result in low reticulocyte counts. So causes of this is aplastic anemia, the myelodysplastic syndromes, leukemia, or bone marrow infiltration by cancer. At number 2, we have nutritional deficiencies. So deficiencies in essential nutrients needed for red blood cell production can lead to decreased reticulocyte counts. So here the causes will be an iron deficiency, which is necessary for hemoglobin production, a vitamin B12 deficiency, and vitamin B12 is required for the DNA synthesis in red blood cells, or perhaps a folate deficiency. And folate is also an essential component for DNA synthesis and cell division. So deficiency in any of these nutrients will lead to an abnormally low reticulocyte count. At number 3, we have chronic kidney disease. So the kidneys produce erythropoietin, which is a hormone that stimulates the bone marrow to produce red blood cells. In chronic kidney disease, reduced erythropoietin production can lead to a low reticulocyte count. So the cause here for the low reticulocyte count will be long-standing kidney disease or even kidney failure. Coming in at number 4, we have the bone marrow suppression. So certain treatments or conditions can suppress the bone marrow's function, leading to decreased red blood cell production. So here we have causes like chemotherapy or radiation therapy, and these are treatments that can damage the bone marrow, or certain medications like some drugs used in cancer treatments like fluorouracil or oxaliplatin and immunosuppressants can suppress the bone marrow's activity, leading to abnormally low reticulocyte counts. Continuing with causes, coming in at number 5, we have chronic inflammatory diseases. So chronic inflammation can interfere with the body's ability to produce red blood cells, resulting in a low reticulocyte count. So autoimmune diseases like rheumatoid arthritis or lupus or chronic infections or inflammatory bowel disease will all also lead to low reticulocyte counts. At number 6, we have hypoplastic anemia, which is a type of anemia where the bone marrow does not produce enough red blood cells. And causes here include diseases like aplastic anemia, exposure to toxic chemicals, or having certain infections like the parvovirus B19. At number 7, we have endocrine disorders. So hormones play a role in stimulating red blood cell production, and deficiencies in certain hormones, like decreased erythropoietin production, can result in a low reticulocyte count. So here, the actual diseases that cause this may be hypothyroidism or hypopituitarism. At number 8, we have liver disease. So the liver plays a role in producing substances necessary for red blood cell production, which means that liver dysfunction can impair this process. So causes here for low reticulocyte counts may be chronic liver disease or even liver cirrhosis. At number 9, we have post-transfusion effects. So after a blood transfusion takes place, the body may temporarily reduce its own production of red blood cells, and this may lead to a lower than normal reticulocyte count. So here the cause for a low retics count will be a recent blood transfusion. And finally, at number 10, we have bone marrow failure syndromes. So these are genetic or acquired disorders that cause the bone marrow to fail in producing sufficient blood cells, including the red blood cells. And here we have diseases like Fanconi anemia or Diamond-Blackfan anemia that may also cause a abnormally low reticulocyte count. So as we have just seen, a blood reticulocyte count test is an important test because it helps us to evaluate how well your bone marrow is producing red blood cells and also serves as a valuable tool in the diagnostic and monitoring processes for various hematological conditions. And that brings us to the end of this video. So thank you guys so much for watching. I hope you found this presentation very beneficial and informative. Please make sure to like, comment, subscribe, and share this video with some of your friends in the medical community. Take care and have an amazing day further. Bye for now.